All right, thanks, Donna. Hi, everyone. My name is Gunnar Esiason. I am 30 years old, living with cystic fibrosis, and I'm excited to talk with everyone today at the Research America National Health Research Forum. So today I want to talk a little bit about my life with cystic fibrosis. I'll talk about the Boomer Esiason Foundation. I'm going to talk about also my path through clinical trials and to where I am today with cystic fibrosis. And then I'll close up with some of my takeaways from my past experiences, living with critical illness and sort of my hopes for the future. But first, I want to start with what is the Boomer Esiason Foundation. So I was diagnosed with cystic fibrosis in 1993, while my dad, Boomer Esiason, was at the peak of his NFL career. The foundation was founded not long after I was diagnosed. And we do a number of pretty much key activities. First is we provide financial assistance programs to people living with cystic fibrosis and their families. Our most successful program to date is our Cystic Fibrosis Scholarship program, which has contributed about $3 million to people living with cystic fibrosis who are pursuing higher education. And we have awarded about 500 people with cystic fibrosis since 2012. We also provide clinical improvements to cystic fibrosis centers, which includes but not limited to adult cystic fibrosis programs at Columbia University in New York and then Atlantic Health's Morristown Medical Center in New Jersey. We've also contributed a great deal of financial resources to clinical and lab research efforts, which includes different research projects. But one I do want to highlight is we are currently supporting one of the largest mental health interventional clinical trials in rare disease right now, and that's being done at Thomas Jefferson University in Philadelphia. And then finally, we also work with patient advocates, and we provide platforms for patient advocates to get their story out, right? We feel like patients should be empowered to talk about their lived experiences with cystic fibrosis and rare diseases, as they experience their health conditions. And you can find out more about our family's foundation at esiason.org. And to date, I'm proud to report that we've raised in excess of $160 million in the fight against cystic fibrosis. So, where did we start? We started with a quarterback's crusade. I was 2 years old, diagnosed with cystic fibrosis, and I was on top of my dad's shoulders on Sports Illustrated. But because I grew up in the home of an NFL athlete, I always felt like I wanted to be an athlete. I wanted to be a football player. I wanted to be the high school quarterback, just like my dad was when he was growing up. Living with cystic fibrosis during my childhood, I felt sort of the average progression of the disease at that point. We had some ups and downs. There was some good times and some not so good times. But fundamentally, I was able to, be an athlete. And I think I should give a lot of credit to my parents for raising me in such a way that allowed me to experience a typical childhood and empowered me really to contribute and be a kid just like everyone else. So when it came time to play high school football, my parents were apprehensive at first. I will admit that my dad, although having played in the NFL, was apprehensive for his son to play football too. But I will say, I think I was the one who convinced him to let me do it. And that's really where I learned the value of a team, right? Living with cystic fibrosis is, very individualized. It's very unique to every individual person, but persevering and pushing through, living with a chronic illness requires, a community, requires a village, and it requires teammates. And, when I played football, those were some of my best memories that I had, especially early on in my high school career, because it was, because I had teammates who were looking out for me, who were willing to modify their workouts, modify practices to accommodate, every single issue that I may have had. But by the time I was sort of towards the end of my high school career, my health started to decline. So I finished my junior year of high school, looking to being the starting quarterback in my senior year. I had taken over, the starting role and, significant playing time towards the end of that season. And I felt like I was finally on the precipice of, realizing my dream of being a starting high school quarterback. Unfortunately, that summer, though, I developed mononucleosis, as most high school kids sort of get exposed to. And it really did a number on my health. It was the first time in my life when my pulmonary function numbers, which is sort of like the measure of health in cystic fibrosis, because cystic fibrosis is, while yes, a genetic condition that leads to protein dysfunction, it usually manifests in very severe and rapidly progressing respiratory disease. So, when I was 16, 17 years old, in between my junior and senior year of high school, it was really the first time in my life when I had seen my pulmonary function numbers decline without actually recovering, because that mononucleosis, sort of flared every single symptom that comes along with cystic fibrosis. So as the summer went on, I realized that my body was wasting away, right? I was no longer able to keep on muscle mass. I was losing tons of weight. It was hard to breathe. I was coughing incessantly. I spent that entire summer in and out of the doctor just trying to figure out how we could stop this progression, because I had one thing on my mind. It was all about playing football that senior year. And it really just kind of, snowballed from there, right? It just became so much more difficult to actually, go about and do the things that I wanted to do in my day, until finally in August, preseason training camp rolled around. And with that, I showed up to camp and realized that I was no longer fit enough to play football. But I was stubborn. I was a stubborn 17-year-old kid, as most kids, probably are around that time in their lives. And I felt like I was going to play football regardless of what my body was telling me. I think my coaches were a little worried. They had seen my physical condition and realized that I probably wasn't in, a state of health to really to take advantage of being a football player. But nonetheless, they let me try. But it's sort of all changed during one conditioning session during a hot August day back home in Long Island, New York. We were doing sprints back and forth across the field. After the sprints ended, we were down on the ground doing push-ups. And with that, I collapsed. I collapsed on the field. It was everyone's worst nightmare, sort of realized as I went down. I finally came to, I looked up and I saw my teammates surrounding and looking down at me, trying to figure out what the hell had happened. And I kind of I picked myself up. I said, "It's okay, guys, I'm okay." But I saw in their faces a look of fear that I had never seen before that moment. When I realized on my own body, I looked down and I saw my practice jersey was just covered in blood. I had a massive hemoptysis that led to my collapse on the football field that day. And there's the trainer running over. There are my coaches. And the only thing I could think of at the time was, oh my God, we need to call my mom. Don't call 911. Don't call for help. Just call my mom. She'll know what to do. And that's what we did. We called my mom, got a hold of her, and she was, at school a few minutes later. And there we were on the way heading to my CF doctor's office in New York City, where I had one of the most difficult conversations with the physician I'd ever had in my life. And what we had discussed was, Gunnar, I don't think it's safe for you to play football anymore. We need to treat this cystic fibrosis. So in the matter of, a few hours, my dream was taken away from me. No longer was I going to be able to be the starting quarterback of my high school football team. And it's because cystic fibrosis took that away from me. And, the truth was, I learned in that moment that, there's no other way to live or treat a chronic illness than by being very aggressive to treat it. We pursued an aggressive course of action because at that point it became, let's make sure that, Gunnar can go to college. That's the real goal here. I think at that point in time, I was so narrowly focused on playing football that I had sort of lost the big picture idea of everything else that's great and comes along with life. So, that aggressive course of action and treatment did actually work and stabilize my health to a point that allowed me to enroll at Boston College. But when I got to BC, I was quickly confronted with one health challenge after the next until about halfway through my undergraduate studies, I developed pancreatitis. And pancreatitis, for those of you at home who may not know what it's like to actually experience it, it's probably one of the most painful and debilitating things that I've ever had to deal with. And the way that I was treated with it, treated for pancreatitis, was just complete fasting for about a week or so, maybe a little longer in the hospital. And by the time it was all sort of said and done, my pancreatitis was resolving. I was weighing in at less than 130 pounds. And that's a problem because I'm 6'2". So I was essentially skin and bones, there at 19 years old, and confronted with one reality in front of me. If I wanted to survive, I would require a feeding tube to live. And that's what we did. We placed the feeding tube. It sort of gave me a couple good years there, allowed me to finish college. There I was, the proudest day of my life, completing college. But the truth is, that photo of me at BC is, it hides everything that I was feeling underneath there. I had a goal of, going on to law school, and looking back, I'm not sure why I ever wanted to do that. But, I think it was another scenario where I had to, come to grips with myself to understand that I was not healthy enough to move on. I had one option ahead of me, and it was to move back in with my parents and stabilize my free-falling health. And that's unfortunately what I had to do. And as a 22-year-old kid, when I'm graduating college, it's supposed to be a great time in my life. I'm supposed to move on, supposed to start a career, supposed to develop professional contacts, develop a network. I was seeing my friends do that. I was so happy for them. But at the same time, I felt like I was missing out on that, right? I felt like I was missing out on everything that I had worked towards in my life at that point. And it was hard. I think I was lacking purpose. I was lacking really sort of everything that it means to be human at that point in time, because I was simply just living from one day to the next. And, over the course of the next several months after my college graduation, my cystic fibrosis rapidly progressed, right? I was in and out of the hospital, or in and out of, the operating room every several weeks. It was a victory for me if I could get out of the bed in the morning and go to the bathroom unencumbered without, coughing along the way. That was a serious win. Another win was, stringing together a couple of weeks together, because it was just, I felt like I was in a rhythm of feeling okay for a week or two. And the next thing you know, I couldn't breathe, and we would be on the way to interventional radiology to place a PICC line to start another course of antibiotics. And during that point in time, I started to confront antibiotic resistance. The antibiotics started to fail. I started going from, first line to second line to third line, and then finally all the way to antibiotics of last resort. And during that time, it's all happening so fast, and it just feels like it's out of your control, that you can't do anything, until finally I was presented with the opportunity to enroll into a clinical trial. And that's kind of how it worked out. I first enrolled into a clinical trial at the end of 2013. The result did not work for my cohort, but I learned the value of clinical research and of clinical trials, especially within a rare disease, right? And I've sort of convinced myself that when you're living among a population that's so small, you don't have the benefit of saying no to a clinical research opportunity, because the only way you're going to advance the prognosis of a condition is if every single patient does his or her part to enroll in these clinical research programs. And it ended up being the first of three major clinical trial programs that I enrolled into between the course of 2013 and 2019-ish. But, while I was going through that, my health was still in disarray. I was still really, really struggling. Over that 5-year period after graduating from college, I went through about 24 medical procedures or hospitalizations. I mean, that's a very, very difficult existence, right? There's no way to develop a rhythm. There's no way to find career growth. It's hard to, find relationships. It's hard to do everything that we all think is so great about life. But at that time, I found my now wife, Darcy, in that, and she was really a rock by my side that helped me through some of the hardest days of my life until 2018, when I enrolled into a clinical trial program that, for all intents and purposes, changed my life. I enrolled into a program for a CFTR modulator that essentially corrects the protein dysfunction at the heart of cystic fibrosis. I am a little bit of a research geek and a little bit of a data geek, so I had been watching this one drug move through earlier stage clinical trials. I had been on top of it. I had been optimistic about it. But of course, when you dive into a clinical trial, you have no idea whether you're going to get the placebo, the real drug, if it's going to work. There's a lot of different variables that our trial participants out there have to manage. And it's frankly, it's a very stress-inducing feeling. And during that, I remember driving to day one of the clinical trial, feeling like, I'm either on the precipice of a huge disappointment in my life or a life-changing moment. Like the phase 2 data for this particular drug had looked so good that I think I put all my marbles in the basket, and it was it was a motivator at the time for sure. But at the same time, I think it was also a little bit of a coping mechanism, right? I had realized that I was so sick, my health was progressing in the wrong way, but I just had to have some sort of hope. And lo and behold, I dosed on this clinical trial. It was the trial was blinded, but the effects of the drug were so substantial that I realized in about 2 or 3 days that I had gotten the real drug, simply because my cough went away. I could finally breathe. And the way that I measure the effect of this trial is that I actually play rec league hockey with my dad back home in New York. So my dad, big football player, loves to play hockey. It's kind of a weird thing, kind of a funny thing. But all throughout my adult life and growing up, I had played hockey with him. It's like a fun father and son thing that we share together. Especially when I was super sick, those days were not fun for me. I'd get out on the ice. I'd maybe skate for about 2.5 minutes, throughout an entire game. I was a little coughing. I was spitting up Pseudomonas. It was a disaster. About a week after dosing on this clinical trial, I felt like a parachute had been taken off my back. I was skating full speed. It felt like I was a kid all over again. It was simply amazing. But I'm also at that time confronted with, what the hell do I do with my life now, right? Everything is like suddenly unlocked for me. I'm no longer considering, a hospitalization. I'm no longer considering further treatments. I'm no longer considering, the prospect of diminished life expectancy. Like, I'm just at this point in my time where I had to think about the future. I have a girlfriend now for a couple of years. I'm still living at home. Should I leave? And believe it or not, on the New Jersey Turnpike, stuck in terrible traffic after maybe the first vacation that my now wife and I had taken together because I was so healthy. She said, I think you need to think about, going back to school or going to business school or something to change the trajectory of your life. And that's exactly what I did. I applied was accepted to an MBA and an MPH program at Dartmouth College. We moved out of my parents' house. We moved up to New Hampshire. I mean, all these things just started happening so fast. My then at the time girlfriend, now wife, we got married, and most importantly, we're now expecting a child. So it's amazing what 3 pills have done for my life every single day since 2018. It's given me an MBA. It's gotten me married. I'm expecting a child, and I'm no longer living with my parents. I mean, it's simply one of the most amazing things that I think it's ever happened and will ever happen in my life. And the truth is, my story in cystic fibrosis is not unique. This is happening to the population at large across the United States. A very dear friend of mine living with cystic fibrosis, now on the same drug, was on disability for a number of years, came off disability, and is now working her dream job in her 40s, right? It's just a simply amazing, amazing thing. So I want to wrap up with looking ahead, right? What did these, the 10 years of really critical illness teach me? And what do I want moving forward, right? My clinical trial experiences were rewarding, but they need change, right? The notion of randomizing somebody into a placebo is stress inducing. I felt that stress on the way to every clinical trial I've ever participated in. But I mean, when you sign up, that's a possibility, but does that mean that's the only possibility? I would love to think about different clinical trials, whether it's synthetic placebo controls, adaptive clinical trial platforms, and there's got to be ways to make it more accessible. I think the last year and a half of COVID has shown us that telehealth, remote patient reporting, and remote patient monitoring are all possibilities. How can we infuse that into the clinical trial stratosphere? 2, and I know it's a big part of this conference, the antibiotic market needs to be stabilized, right? People with cystic fibrosis are uniquely positioned in the middle of this, breakthrough science, technology, heavily personalized medicine on one side, but on the other side, we're all relying on antibiotics made in the 1960s. So something in there has got to change. We see the benefit on one side, but our policymakers really need to understand the antibiotic market. I think we're all living and we understand the impact that infectious disease can have on us in this world. And I would hope that, instead of shutting the world down again, we can get ahead of this next health crisis before it even rears its head. Next, our our telehealth wins from the pandemic are remarkable, and they need to stick around, right? I think it's an amazing thing that I didn't go to a CF doctor or see a CF doctor or or have a stethoscope laid on my chest for over a year during the pandemic. That's just like, a crazy thing for me to hear and think about and look back on, especially given where my health was. It's almost like, this clinical trial and this breakthrough drug happened for me just in the right nick of time, because I don't know what I would have done had it wasn't there during this time of disrupted care. But fortunately, I've been stable enough. My friends with CF have all enjoyed some stability. And that's shown me that, I think telehealth is okay to manage care moving forward. I'm not saying we need to, replace every single in-person visit, but I think it's also shown me that I can go to school full time and also manage my cystic fibrosis care. And instead of driving all the way to the CF center, I can dial in for, a quick visit, a quick checkup. And I have the equipment at home now to monitor my health and communicate with the clinic. And then finally, I think this is the most important thing of all this. Don't try to fix something that isn't broken, right? 3 pills every single day have changed my life. That's the truth, right? I went from critical illness, near end stage illness, to all of a sudden living across the country or living a few states away, married, have one graduate degree, working on a second graduate degree, and a child on the way. That to me feels like whatever is existing in our drug infrastructure is very clearly working, right? And I'm not sure that needs to be fixed because it frankly isn't broken, right? And I want to make sure that, the experiences that I've, understood and have actually felt with breakthrough technologies addressing my unmet medical need are now carried over to other patient populations, right? There's people out there who still have unmet medical needs. And the last thing we need to do is disrupt the innovative technologies and pathways to get those drugs to those folks too. So with that, I want to thank everyone for your time. Make sure you can follow me on Twitter, on Instagram. I've got a website, GunnarEsiason.com, and my podcast, The State of Health. You can also check out our foundation, Esiason.org. But again, a big thanks to everyone for dialing in. It's great to talk with you today, and I hope to hear from you in the future.